Hello everyone, my name is Alfian Triputra and today I will present a complete short note based on a sport injury case. For this assignment, I chose a case of a grade 1 lateral ankle sprain that happened during a basketball activity. For the subjective part, the patient is a 20 years old male basketball player who reported pain in his right ankle after landing incorrectly from a jump during practice 2 days ago. He explained that his pain level is 5 out of 10 when resting and increased to 7 out of 10 when walking or putting weight on the ankle. He also complains of swelling around the outer part of the ankle, difficulty walking normally, and a feeling of instability when standing on one leg. The patient already applied ice and took over the counter-pain medication immediately after the injury. He denies any previous history of serious ankle injuries or fracture. Next is objective part. During the physical examination, the patient walked with a mild limp. When observing the ankle, there was mild swelling around the lateral malleolus without bruising or deformity. During palpation, the patient showed tenderness around the anterior tibiofibular ligament, and there was also slight tenderness around the calcaneus fibula ligament. The range of motion assessment showed limited and painful dorsiflexion, slightly limited plantar flexion, painful inversion, and normal eversion. For special testing, the anterior drawer test was slightly positive, which indicates mild ligament laxity. Moving on the assessment, based on the patient history signs, symptoms, and physical finding, the patient is diagnosed with a grade 1 lateral ankle sprain that most likely involves the anterior talofibular ligament. This type of injury means that the ligament is stretched but not torn. The prognosis for this condition is generally good, especially with proper rehabilitation and management. Finally, in the plan section, the treatment will be divided into phases. During the first week or the acute phase, the plan includes rest, applying ice for 10 to 15 minutes 2 to 3 times a day, using compression and elevating the leg control swelling. The patient will also begin light movement exercise such as the ankle pumps and ankle circles to maintain mobility. During weeks 2 to 4, which is the rehabilitation phase, the patient will progress to strengthening exercise using a resistance band and will begin balance and proprioception training such as single leg stands. Stretching of calf muscles and Achilles tendon will also be included during weeks 4 to 6, which is the return to sport phase. The patient will start functional exercise such as running, jumping, and sport-specific drills. The patient may use an ankle brace during practice is needed to prevent re-injury. Follow-up session will be scheduled once a week to monitor progress, adjust exercise, and ensure a safe return to activity. That is the complete short note presentation for a grade 1 lateral ankle sprain. Thank you for listening.